Okay, when?
Oh, I didn't see you there. I was just reading my Diagnostic and Statistical Manual of Mental Disorders 5th edition by the American Psychiatric Association. In particular, I was reading about mental illnesses prevalent in children and adolescents. It's a really interesting subject. In fact, why don't we take a minute to look at some of the pressing issues and concerns in regards to this subject?
Before we get into the topic at hand, we first have to talk about wicked problems. A wicked problem is any problem that is difficult or impossible to solve due to constantly changing or contradictory requirements or information. Note, however, that not all wicked problems are impossible. Some are just extremely complicated issues, but ones that can absolutely be resolved with enough time and cooperation. An example of one such wicked problem would be climate change. It's a subject that many people have different stances on, and that some people are very, very stubborn about, but it's not an impossible problem to solve, and some places have already taken initiative in stopping this environmental crisis. The wicked problem that this video focuses on is understanding mental illness in youth. For our purposes, we considered youth to be all groups under the age of 18, with specific emphasis put on preteens. The reason this is such a difficult problem is because of the way that child and adolescent brains compare to those of adults. It's very hard to understand the brains of this age group when you consider how much they change over time and the different rates at which different children develop. Gross misdiagnosis causes huge problems in a person's life. It hinders their treatment, which means that their distress will be prolonged as they waste large amounts of time and money on ineffective solutions. Mental health treatment is complicated. There are many people who have to get involved to make it possible. Stakeholders are those in a certain industry that would be affected by any reform or change in the system. In mental health situations, and with many if not all people who suffer from mental health issues, the main stakeholders include the patients themselves, family and friends, psychiatrists and their educators, pharmaceutical firms, and government healthcare plans. With 1 out of 5 people on Earth having an issue with mental health or suffering from mental illness, the changes and the patients, as well as their family and friends, are drastically affected by reforms. It's easy to see why the patients, as well as their families and friends, are drastically affected by reforms, as many of them include either raises in price for treatments, or different laws that could potentially harm the individual suffering by not allowing them to get the adequate or best care available. However, pharmaceutical companies, as well as those government health plans, could also suffer due to price cuts or increases in certain areas. They would also need to provide evidence-only based care. As for the needs of these stakeholders, they are all relatively the same. All of these entities may be impacted financially, whether that be for good or bad, due to either cuts or raises in potential income and cost effectiveness. The patients need information to understand their illness better, to gain an appreciation of their treatment options, and to enable them to participate actively in their treatment. The field of medicine and mental health is ever-changing. This makes it difficult to appropriately diagnose individuals with certain disorders. In order to combat this, treatment professionals do their best to identify at-risk patients. However, it's common for individuals to need care, but to not know what help to pursue. One way that mental health professionals are trying to combat this is by partnering with primary care professionals in order to find the most accurate diagnoses. Another common problem is that some minority children may have trouble expressing their symptoms due to a cultural gap, which impacts the difficulty of diagnosing them. As a reaction to this, treatment professionals are being educated on their patients' cultures, according to a 2018 study. A large amount of children who are suffering from mental illness have experienced mistreatment by their families or other such traumas. This makes them difficult to connect with for some mental health professionals. These professionals have been developing a program which can connect children with treatments that are particularly effective for children with such a difficult past. Studies as recently as 2019 flesh out these programs in more detail. Dealing with all of this can be very stressful, which is why professionals often offer family therapy to help them understand their child's feelings and the treatment process. A 2017 study explores how this can be effective. Treatment centered around the patient and stakeholders can take a cognitive behavioral approach to family therapy. The applied psychology of systems psychology will allow a therapist to recognize a change in a person after introduction to the family individually and then as a collective. The change in one person that's a part of the system is the main reason that the other systems of the family are affected. Such events demonstrate that not only does the patient benefit from treatment, their family does as well. Cognitive behavioral family therapy emphasizes the central role of cognitions and posits that by changing family members' beliefs, systemic change will ensue. Moreover, cognitive behavioral family therapy hypothesizes that the most efficient way to change beliefs is through cognitive restructuring, rational analysis, and behavioral enactment. And there you have it. We hope you found this video to be both entertaining and informative.